يا دكتور جمال
Start with
دكتور
station 5.
station 5. Mr. Hussein is 47 years old. He has been complaining of a skin rash for the last 5 years and a dizziness for the last 1 year. Please take focus history and examination and proceed as appropriate.
Mr. Husseini, how old is he?
47 years old. Of course, I'm here just to share information with you. Of course, some candidates here are better than me, you know. So just I'm here to share information only. It's okay. دكتور أشرف ما شاء الله طبعا أستاذنا دكتور أشرف شحاتة. فجست sessions for الله يخليك يا دكتور أشرف. Just for practicing and to be professional in practicing the cases. We can start, Dr. Ashraf?
We can start, Dr. Saad. تفضل. Good morning, Mr. Husseini.
Okay. Good morning, doctor.
My name is Dr. Ashraf Shahata. I am the internal medicine on call for today, and I received a letter just telling about your case. Are you ready to speak about today?
Yes, doctor.
Just I received in the letter that you have a rash since 6 years. Is that true?
Yes, doctor.
Could you tell me more about that?
I have this skin rash for the last 5 years, doctor, which started gradually, then started to increase with me.
Could you tell me where is the site of this rash?
Yes, doctor. This rash around my eyes, my mouth, my elbows, and my neck, and also my hands.
Where it started?
Started in my face, doctor.
Yes. And can you tell me how did you feel with this rash? Did you feel pain, itching?
No, doctor.
Okay, could you tell me what is the appearance of this rash? It is just a small spots with change of the color of the skin, or it's an elevated spot?
Yes, doctor. It is white and discoloration. Yeah, doctor. It is.
Yes,
rounded, and it is white in discoloration.
And it's covered with scales?
No, doctor.
Did you try to scratch this rash before?
No, doctor.
Is this rash affecting the similar points on both sides of your body?
What is this, doctor? What does it mean?
I mean, if it is affecting the same points on both sides of your body?
No, doctor. It is different in size, actually.
Okay. Could you tell me, you visited a doctor, you consulted a dermatologist for this rash before?
Yes, doctor. One doctor called me. It is called Vitiligo.
Yes. And you received a treatment for it before?
I received some treatment, but there is no improvement, doctor, so that I didn't receive more treatment.
Okay. Did you, your doctor started for you any systemic tablets or oral medicine for it?
Yes, doctor, I started with treatment called the cortisone, but only for 1 month, but I didn't complete my treatment, but because there is no improvement.
Okay. I'm sorry for that. According to my notes, you developed dizziness recently. Could you tell me more about that?
Yes, doctor, I have this for the last 1 year, doctor. It's coming with me on and off.
Yes. And when you have this dizziness, you have also a feeling of nausea?
No, doctor. What's nausea, doctor?
I mean feeling sick.
No, doctor.
Okay. Did you develop any episodes of low blood sugar?
I'm not sure about that, doctor. I didn't measure my sugar before, blood sugar before.
Did you? And did you develop any episodes of low blood pressure?
I'm not sure about that, doctor.
Did you develop any areas in your body with increased color of the skin? I mean dark skin?
No, doctor.
Did you develop a poor blood or anemia?
I'm not sure about that, doctor.
Did you have any tummy pain?
No.
Okay. And you don't have any feeling of swelling in your tummy or any heaviness in your tummy?
No, doctor.
Did you have increased bowel motions?
No.
Did you feel that your skin comes cold and you don't tolerate the cold weather?
No, doctor, but I feel my skin is paler than before, doctor.
Yes. And you feel generalized fatigue and weakness?
Yes, doctor.
Did you feel any numbness or feeling tingling sensation in the legs and arms?
Yes, sometimes, doctor.
Okay. And what about your family? Any one of your family have a thyroid disease?
No, doctor, I don't know about that.
Any one
Too
of
many
your family
screening.
have any? Okay. Could you tell me your concern for the time being, Mr. Hussein?
Yes, doctor, I'm concerned about this disease. What could be the cause, doctor?
Okay. I will answer you while I'm examining your body. It's okay?
It's okay, doctor.
I want actually to check your blood pressure, and I want to check your pulse, and I want to check your conjunctiva for presence of any pallor. Also, I want to check
There
your
is pallor on
skin
the
all over.
conjunctiva.
Yes.
Skin, there is
And
whitish macule, milky white macules around the eyes, the mouth, and the hands and the elbows.
Okay. Could you tell me if I examine your tummy, if there is any splenomegaly?
No need, doctor. Go on. Abdominal examination is normal.
Can I examine your peripheral sensation?
No need, doctor. It's okay. Go on.
I'm sorry, I forget to ask you, are you a smoker?
No, doctor.
Are you alcoholic?
No, doctor.
Okay, for the time being, Mr. Hosseini, we have the diagnosis of vitiligo as a chronic skin disorder, and this vitiligo is an autoimmune disease that may be associated with organ-specific autoimmune disease. This suspected organ-specific autoimmune disease in your condition, it's maybe something called pernicious anemia, a form of decreased vitamin B12 absorption from your gut. And in this case, you will have frequent dizziness and anemic symptoms. In this condition, we need to do some blood test to check for the antibodies against specific cells in your stomach. And we need also to do vitamin B12 level in the blood. I want to refer you to one of hematology consultant to check you. Also, I want to find some pamphlets and brochures to help you to understand about the autoimmune diseases. Okay, Mr. Husseini?
Yes, doctor.
Did you have any other point of concern?
Yes, doctor. Regarding exposure to sun, doctor, does it improve my condition?
I'm sorry, Mr. Hosseini, you need to avoid exposure to sun because your vitiligo may be irritated by sun exposure. You need to have sunscreens and sunblock, and to avoid getting out in the streets. Also, you need to have a formal education about vitiligo and about the different treatments available for it. As you know, there is no single treatment can be effective for all patients of vitiligo. Some medications can be helpful for some patients, but it will not be for others.
Yes, doctor.
Okay, Mr. And I want also to help you to avoid any trauma because at the sites of the trauma, you may develop a new lesions of vitiligo.
Yes, doctor. I have other concern, doctor.
Yes, you are welcome.
I have 2 children, doctor. So they may have the disease, doctor?
The disease is actually have a tendency to run in families, but the actual transfer form of the genes, it's not known up till now. It includes a lot of genes, and we are not sure if your children will develop the disease or not. There is tendency for that, but we don't count the percentage. Any other question, Mr. Husseini?
Thank you, doctor.
Thank you. Thank you.
No,
Mr.
thank you, doctor. Thank you. Dr. Ashraf, the time. Still, the time factor is very important in station 5 and all the stations. Okay, so what's your diagnosis for the patient?
There is a chronic diagnosis, which is a skin disease called vitiligo. It's an autoimmune disease that involves the melanocytes of the skin. And this autoimmune disease may be associated sometimes with end organ specific other autoimmune diseases, like the pernicious anemia, like the atrophic gastritis, and also it may be associated with thyroid autoimmune diseases, for example, Hashimoto or Graves' disease. It may be associated with diabetes type 1, and also it may be associated with some other autoimmune diseases.
What would be the cause of dizziness in this patient with vitiligo?
I'm suspecting actually due to the presence of the form of sensory peripheral neuropathy. I'm suspecting that the patient may have a vitamin B12 deficiency, and in these conditions it will be just a presentation of the pernicious anemia in addition to dizziness.
What other causes can cause dizziness in this patient?
There is other cause which is related to the adrenal gland. It's called Addison disease, and this Addison disease actually is an autoimmune disease that can be presented with hyperpigmentation of the buccal mucosa and the palmar crease, and it will be associated with frequent dizziness and feeling sick.
Any other cause can cause dizziness for this patient? Other than you mentioned already pernicious anemia, diabetes mellitus, celiac disease can cause.
Yes, celiac disease can cause as a secondary outcome. As a secondary outcome, it can lead to iron deficiency anemia, and so it will be presented as a dizziness as a complication of celiac disease.
Okay, what you are going to do for the patient?
I'm going to refer the patient to dermatologist and also to hematologist just to continue the management of the patient. I need actually to do a serum vitamin B12 level, and also I need to do for the patient varietal cell antibody.
Just to mute the mic, Dr. Mate, only the one who is going to present the case to open the mic. A lot of echo. Dr. Malika, just mute the mic, please. Okay, Dr. Ashraf. So investigation again, Dr. Ashraf, please.
Investigation, I will ask for a complete blood count to check for the mean corpuscular volume and to check for the presence of the megaloblasts and the megaloblastic anemia. I will ask for serum vitamin B12 level and red blood cell folate. Also, I will ask for the parietal cell antibody, and if there is a possibility for doing a chilling test to prove the presence of pernicious anemia. Most probably, if there is the vitamin B12 deficiency, we need to give the patient an injections of methylcobalamin. Methylcobalamin can be given as 1,000 units intramuscular injection initial, and we can follow it every other day for total 10 days. And then we can taper it to be 1,000 every 1 week, and then to be 1,000 every 1 month. Most probably he will continue on vitamin B12 injections for life.
Okay. Thank you, Dr. Ashraf.
In addition to the treatment. Thank you, Dr. Saad.
يعني ما شاء الله دكتور أشرف يعني a lot of knowledge and very organized, but you know the time factor, Dr. Ashraf, is very important. So you don't have the welfare of time to explain in details like that. So maybe the time will pass and you didn't tell what you want. So you reached the diagnosis already. It's the case of vitiligo associated with pernicious anemia. Okay, anyone want to comment?
أنا بس عندي أسئلة.
Again the treatment, Dr.
Treatment. دكتورة نشوى.
Yes, yeah, Dr. Yes. The treatment.
Dr. Ashraf, he mentioned the treatment already. But he forget to refer the patient to multidisciplinary team from a skin physician maybe and the gut physician to give the treatment. Multidisciplinary team referral is very important in this case as this patient has multi-system disease and multi-autoimmune diseases. So referral to multidisciplinary team is advised for this patient for treatment of vitiligo by a skin physician and treatment of pernicious anemia by a gut physician or gastroenterologist. Any other comment?
أنا عندي كومنت مش كومنت أسئلة يعني.
تفضل يا دكتور أحمد.
طبعا عشان أنا لسه جديد يعني فبالنسبة في حاجات اتقالت أنا مش عارف هي جارجونز ولا ميديكال تيرمز يعني ولا لأ، زي كلمة كونجنكتيفا وسبلينوميجالي وثايرويد ديزيز ونوزيا حضرتك علقت عليها وكلمة systemic tablets. يعني هو قال له any doctor give you any systemic tablets. هل كلمة systemic tablets دي جارجونز؟ كلمة thyroid disease جارجونز ولا لأ؟ conjunctiva وسبلينوميجالي.
Splenomegaly, I don't think Dr. Ashraf he said splenomegaly by name يعني. أو ما قالش conjunctiva برضه for the patient يعني. لكن هو طبعا conjunctiva splenomegaly this jargon طبعا. Thyroid disease يعني ما تعتبرش jargon if you asked about the medical past history. You are asking about the past history, family history of any thyroid disease. No problem with thyroid disease. Okay, so as we said, time factor is very important in station 5. And in this case, in skin case, we have to ask about any skin rash, about the onset and the course, duration and progression, site and the size and the color and the distribution of the rash, worsening factor and improving factor, and this is what Dr. Ashraf missed. Do you notice anything that worsen your skin rash, like trauma, exposure to sun, stress, smoking, alcohol? Did you notice anything that improve this skin rash? Is it painful at all? Is it oozing, lynchable, or itchy? Dr. Ashraf already covered most of the analysis of the rash, but it has been by a rapid way. Other than that, rapidly, because we have to ask about all the other associated autoimmune diseases with vitiligo. And to make it easy for you, we'll divide autoimmune diseases in this way. We have gastrointestinal autoimmune diseases, rheumatological autoimmune diseases, endocrinal autoimmune diseases. For example, endocrinal autoimmune diseases, we have hypohyperthyroidism, diabetes mellitus, and Addison disease. Okay, so hypo and hyperthyroidism, is there any weight loss or weight gain? Is there any racing of heartbeats? Is there any sweating, any checking of the hands, any loose motions, any anxiety, and oligomenorrhea in female patients? And for hypothyroidism, any weight gain, lethargy, and menorrhagia in female patients. Of course, you will not say menorrhagia because it is a jargon, an increase of your cycles, increased frequency or decreased frequency of your cycles. And for diabetes, any increased thirsty, increased appetite, increased urine frequency, and Addison, any disease spells, feeling sick or getting sick, loss of weight, hyperpigmentation or darkening of the skin. These are the endocrinal autoimmune diseases. Then rheumatological autoimmune diseases. We have SLE, rheumatoid arthritis, and systemic sclerosis, and Sjogren's syndrome. So we have to ask about any joint pain or joint pain in your hands, any rash in your face, hearing, fall, or mouth sores. This for SLE. Any shortness of breath or cough, any finger color changes in cold weather. This is for rheumatoid arthritis. Any difficulty with swelling or tight skin, finger color changes in cold weather, we asked it before. This for systemic sclerosis. For gastrointestinal autoimmune diseases, we have autoimmune hepatitis, primary biliary cirrhosis, primary sclerosing cholangitis, and the celiac disease. All of these we can ask about any tummy pain, any loose motions, any yellow discoloration of your eyeballs, and for pernicious anemia, any fatigue or pallor, burning sensation of your hands. Like that, we finish the gastrointestinal autoimmune diseases. And for alopecia, any following over here. Like that, it's all. You have to ask in vitiligo all the associated autoimmune diseases actually. And of course, we don't have to forget social history. Dr. Ashraf already asked about smoking history, but he didn't ask about the patient job, what they do as a job for living, and how much the symptoms impact your job and usual daily activities. It's a very important question. To refer the patient so that I refer you to a social worker to solve this problem for you, and with whom the patient is living for support. And the medical history, do you have any other medical history of note, like diabetes, hypertension, family history? Dr. Ashraf asked about them already, and the drug list of the patient. What's your drug list? So actually, Dr. Ashraf covered all the this station. For examination, Dr. Ashraf started to examine the conjunctiva for pallor and started to examine the abdomen. I agree with him because he decreases pernicious anemia, so that you have to concentrate in the positive data with the patient. Pernicious anemia, you have to start with the hands for finger for conychia, and also the conjunctiva for pallor, and there can be also the oral cavity for stomatitis. This for as signs of anemia. And of course, Dr. Ashraf, we have to see the first vitiligo rash. We have to inspect and examine the vitiligo rash and its distribution, and to make the patient to show you the vitiligo rash all over his body. In the hand examination, examine for the hand, for finger prick, for TM, and the body arthritis for rheumatoid and SLE. And the pulse also, for tachycardia, for hyperthyroidism, for example. And the palmar creases for hyperpigmentation, for Addison, and oral cavity for hyperpigmentation also. And it is very important to ask his examiner, I'd like to examine this patient blood pressure in supine and direct position for Addison disease. As we said before, conjunctiva for pallor and for jaundice also. And abdomen examination is important to mention in this patient, also for organomegaly. Maybe the patient has autoimmune hepatitis or primary biliary cirrhosis or primary sclerosing cholangitis, which can cause hepatomegaly. That's all in this station. Regarding the concerns, Dr. Ashraf, we have to make the concern or the reply of the concern more simple for the patient. We don't have to explain so much, because you don't have the time. You explained it in proper way already, but, we have to make it in short, short statements. Most probably you have this skin rash. You have problem in your defensive system, which is attacking a lot of system in your body. For example, attacking your skin, causing this milky white changes, and attacking also the lining of your stomach, which causing malabsorption of some important nutrients like vitamin B12 and folate. That's why you have this anemia, which is causing your dizzy spells. Exposure to sun, Dr. Ashraf replied probably in the right way. Exposure to sun can worsen your condition, and it can darken the healthy skin and makes your white skin is more obvious, so that applying sunscreen is advised for you. Regarding transmission in the family, there is no specific mode of transmission of vitiligo, but your children may have a chance which is more than the normal population. Because, vitiligo can be inherited, 40% of vitiligo. 40% of vitiligo can be familial, and it can be inherited by polygonal gene mutation. So there is no specific mode of inheritance. It is not autosomal dominant or recessive or X-linked. So just to tell the patient that there is no specific mode of inheritance of this disease, but your chance has more, or the chance of your children is more than the other population. Okay. Anyone want to add anything in this station? تفضل. تفضل.
I think as a part of gender syndrome, we must ask about any white patch in the mouse, and in examination, we must look into the mouse to check any white patch in the mouse. And also ask the patient about the use of hair falling for fasciata, and check the examination also. Yes, and I think lastly, I must ask about any muscle cramp or any stress in the hand or in the feet, because in vitiligo is associated with hypoparathyroidism.
طيب تمام. as a يعني a part of autoimmune glandular disease, you mean Dr. Laila?
Yes, that's a part of
polyglandular disease type 1. Type 1 now. Autoimmune glandular disease type 1. Yes.
He let's go
Okay.
in type 1 and type 2, yes. Yes.
Type 2 is more common. Type 2 autoimmune polyglandular disease is more common. Okay. طبعا يعني we have not to forget that we refer the patient so that multidisciplinary team from a gut physician and from a skin physician. What we are going to do for you is to do for you first a test, and we refer you, and if our diagnosis confirmed, we refer you to a multidisciplinary team to give you the proper plan of management. You will admit this patient, Dr. Ashraf?
Yes, Dr. Sadeh. Actually, there is no need for admission for the time being, and so long the patient is did not have any hemodynamic instability or any severe complications. I need to raise some points. The first of all is the duration of the case in station 5 usually is short because you have a spot diagnosis on admission. And on admission, you will have the spot diagnosis that the patient has vitiligo. And in this situation, there is no need to take a lot of time in analysis of the rash.
Okay.
Here, because we don't have a spot diagnosis, so we take some time to analyze the type of the rash and to ask about the characteristics of the rash through the phone, and at the last we can find that the vitiligo is the reason. The second comment is the differential diagnosis during taking the history. I think the differential diagnosis should be focused because there is no time. There is around more than 20 syndromes you can ask about. And if you have time to ask about these 20 syndromes, you need around 20 minutes. So if the patient have just dizziness, you go in this direction, and there is no need to analyze rheumatoid arthritis, systemic lupus, like that, liver, primary biliary cirrhosis, like that. It will be a very, very long case. You should summarize your mind during the case and go into the direction that the patient take to it. This is the second point. The third point is the jargon. I said splenomegaly to the doctor after the finish of the patient. I said splenomegaly because it's a characteristic of the pernicious anemia. You should check for splenomegaly. As regards the thyroid disease, you have the full freedom to ask about all illnesses in medicine during the family history by name. You have the freedom for that, and this will clear your mind in front of the examiners. When you ask the patient, you have family history of adrenal disease, you have family history of thyroid disease, you must ask like that because there is no time and you want to show to the examiner what you are thinking about. And in family history, it's known all over the world that the person knows the name of the disease that affects his family. It will not be considered a jargon during that item.
I agree with you, Dr. Ashraf, but regarding other all autoimmune disease, it has to be asked actually. I know that this patient has dizziness only, so that you have to concentrate in business. This is your idea. But in vitiligo, you have to ask about all other autoimmune diseases. I know it will be very difficult for you that to ask about all these autoimmune diseases in station 5, which is short station. But it has to be asked. And believe me, if you are practicing and you are doing this station frequently, it will be easy to ask about all of these in 8 minutes. And I remember that I have a case of chronic diarrhea in station 5. You know, chronic diarrhea is a dilemma in station 5. So it's so difficult to ask about all the station 5 about all the causes of diarrhea. You know, you need 14 minutes at least as a case of history taking for chronic diarrhea. But I reached the diagnosis and I picked up the diagnosis from asking about all the differential diagnosis of diarrhea in 8 minutes. When you are practicing well, you will find time for that. But don't ask question away from the disease. If you concentrated on the what you are asking about the autoimmune diseases, other autoimmune diseases, and you are making it organized in your brain as gastrointestinal autoimmune diseases, rheumatological autoimmune diseases, and rheumatological autoimmune diseases, believe me, it will be so easy for you. Okay. Anyone?
The last comment actually is related to the referrals. I will refer the patient to hematologist because the hematologist is the one that will treat the pernicious anemia, not the gastroenterologist, in addition to the dermatologist. The presence of the multidisciplinary team, it's a common, it's a common term, but if you tell the items of it, it's okay. And if you tell that you will refer the patient to dermatologist and the hematologist, and for social worker, for example, it will be okay. That's all.
Okay. Thank you, Dr. Ashraf.